The challenge basically is any situation that is preventing you from reaching your goal. Basically, that's a challenge. Challenges, and I take them as positive because overcoming the challenge is a sign of good growth to yourself, to your laboratory, to your operation. The laboratory is a very interesting environment, working environment. In three major players. You have the equipment, the machine, and you have the resources that you need to operate these machines. And also you have the human power that you need to manage and run and interpret the laboratory result by orchestrating the equipment and the resources. One of the major challenges I have encountered in my career is the utilization of resources. And how would you balance between ordering a supply and using it in time before it gets expired and giving the right results, and also without running out of them. This is a serious issue in the laboratory, and it needs many stakeholders and many players to work as a team together to make this challenge overcome. Whether it was governmental, it was private, small lab, big lab, complex, high, low complexity. Operation of supplies is a major challenge. There was this nice project a couple of years back that we worked in the hospital I work with. In the beginning of formation of a transformation clusters and healthcare clusters, and we actually published a paper out of this project. One of the issues was how to manage a laboratory testing that is coming to us in our hospital from the primary health care. How to calculate the load, how to include the load in our planning of the resources. And planning of the resources, this would include the consumables, it would include the personnel. Do we have enough people, manpower as a resource to run it or not? And also, do we need more equipments or not? So this project, we played it. We actually used the Sibahi standards, with principles of Sibahi standards, to monitor, assess the situation in the primary health care. And from there, we took it back to our hospital and we sat with the planning and purchasing team in subsequent meeting and subsequent procedures to find new way of operation. And we managed to implement it over a window of 9 to 10 months. And we monitored it through the known KPIs that was advised by Sibahi, and we found an increase, improvement in the KPIs that we have monitored. Dramatic improvement, alhamdulillah. Yes, there is always challenge.
There is always.
Thank you very much.
Allah يعطيك العافية. Thank you very much, Dr. Sabri. يعطيك العافية.
Common أو the biggest challenge that not just a toxicology lab, any lab would face is trying to match quality with resources. دايما there is a mismatch. دايما we want to provide the best quality for our stakeholders. لكن دايما the resources are represent a challenge.
التحدي هو الأمر الذي يستلزم جهد زائد للحل وصعوبة في التنفيذ. العلاقة مع الأطباء المعالجين والتواصل معهم، وأيضا المعرفة الكاملة بأمور الجودة والكوست اوف نسميها ضريبة الجودة السيئة بالمختبرات. نظرة المجتمع للمجتمع الصحي العاملين في القطاع الصحي إلى تخصص المختبرات وأهميته ومدى استفادتهم منه للوصول إلى الخدمة المثلى للمرضى. هو البوينت اوف كير تيستينج، عملية إدراك الناس لأهمية هذا الخدمة المقدمة للمختبر ومن هو المالك الحقيقي لها.
我们解决不了的问题，我们会向上级组织反映。
我先翻译一下这一段。She said in her daily works there are many things that they cannot very easily handled, and she think it's a challenge. But however, she think every work and every life will have its own challenges, and they have a team to solve the problem. So she don't think it's a very big question.
应急预案也有。
So she think a long time, and she didn't think there are so huge challenges in her daily work because all the situations will be you will have planned to solve it. So for example, if there is somebody sick that cannot come to the work, they have backup teams to take the person's positions and continue to the normal work. And if there is breakdown in electricity or the water supply, there are also some emergency storage of electricity or the waters. So she thinks the lab's running situation is very good, and they have many backup cases.
到现在还没有遇到过没有克服不了的困难吧。
Yeah, she says the challenge is normal and is general, but as we are a firm team and as we work together, unite together, we will solve the problem eventually. So by now there is no that such problems that we cannot conquer. All problems.
Challenge means something over my limit that I cannot do now. It's impossible things. So means we need to try our best to find a lot of solution or a lot of way to overcome this difficulty to make impossible become possible. The challenge for me, actually, I love challenge because challenge made me grow up, made me improve a lot. Sometimes if you don't have challenge, you just stay in your safe zone. You cannot see anything outside the world, and also you cannot know where is your limit. So challenge also always make me grow up very quickly, especially in this year. I based in Saudi Arabia just 9 months. Now I know all the hospitals in Saudi Arabia. I also know a lot of people, even learn a lot of Arabic. So at the beginning, I was really suffer about it. Really difficult for me. So most difficult things is language and food. Yes, and we are from China. So, and the previous thinking of all the people's Chinese company maybe doesn't have a lot of innovation technology, and we are copy paste other products with low quality. Actually, we are the leading company in China. We are doing a lot of difference and making a lot of challenge in the industry. So this is the first challenge I need to overcome and to explain to our customer. And the second challenge for the local market is we need to convince back to our manufacturer. In Saudi Arabia, we need this kind of products to more suitable, to more apply with the requirement from Saudi Arabia hospital and laboratory. Thank you. Thank you. Shukran.
Laboratorians are not unique in the area of medicine. They're oftentimes very specialized with specific training and requirements, education, knowledge. And so it's not equivalent to have all laboratory technologists considered the same. They all can't do the same testing in the laboratory. A microbiologist may not be able to handle a chemistry equipment. It would be analogous to me as a pathologist wanting to do neurosurgery. There are specific education requirements and qualifications. There's also specific training and competency that needs to be performed and maintained. Yes, there are some very non-specialized tasks that are performed. Phlebotomy, specimen collection, specimen accessioning. The requirements for those individuals are not very rigorous, and individuals can perform those tasks. However, a number of tasks within the laboratory, particularly doing patient testing, need to be done by individuals with specific knowledge, experience, and training. Even within the laboratory, individuals who are experienced in one area of the laboratory may not necessarily be able to perform testing in other areas of the laboratory. You wouldn't want a microbiologist, say, going in and doing specialized HLA testing. Those individuals who do blood bank testing, who are doing tasks that their need to be very specifically done for the health and safety of the patients needs to be done by someone who can do that task and is familiar with it. You can't just pull another person from the laboratory to cover that department without specific training and knowledge. Training of pathologists can be quite long. Typically in the United States, there's 4 years of undergraduate study. There's then 4 years at medical school. Pathologists then undergo residency training, which is typically 5 years. Many of them, including myself, go through additional fellowship training, which may be 1 or 2 additional years. So when you add that all up together, you'll see that it's quite a long time to be trained as a pathologist. And even then, a pathologist just coming out of even a fellowship program may not necessarily be ready to take on all of the responsibilities throughout the laboratory. So sometimes it takes years in the job in order to feel competent and confident in covering some areas of the laboratory.
Can any pathologist, can any technician be cross-trained in all the different sections? And there are some areas of the lab that's easy to do cross-training. The disciplines are fairly similar, but there are other subspecialties in which additional training and expertise, especially when there's molecular techniques, extraction, purifying DNA, these require additional training, often additional certification. One of the areas in the lab that we don't do cross-training tends to be in microbiology. A lot more hands-on, technique-specific, and the human touch is very important. So there's not a one-size-fits-all solution for every lab. And definitely, CAP has also resources that can help you project manpower requirements and optimal staffing, whether you have a general lab, you have a specialty lab. Shukran.
The profession of laboratorians, the dynamics in the laboratory, and how do we carry out our responsibilities in support of the healthcare system. Dr. Don.
Yes, great to be here. Now, I'm very happy that you stopped by to the CAP booth here at MedLab Middle East. So the laboratory team is incredibly important for patient care. And ultimately, everything we do is focused on the patient. The pathologist typically is the leader of that team, but we can't do our job on behalf of the patient without all the other members of the team. We need very good supervisory staff that can help supervise our laboratories. We need technical staff at different levels with different levels of knowledge and experience and expertise, particularly when it comes to emerging new technologies. Molecular pathology requires very, very highly trained, highly skilled technologists that work in the laboratory and do the increasingly sophisticated assays that we do in that laboratory. Digital pathology is rapidly developing as the way that we will be practicing pathology in the future. And yes, the pathologist is interpreting the images, but we also need very skilled histotechnologists that can create proper slides that can then be scanned and digitized so that we can make the most effective and accurate diagnoses. At this meeting, there's a lot of interest and excitement about artificial intelligence, or we like to say augmented intelligence. This is a very important new technology, but we need both pathologists, but also other members of the team that are trained to help us validate and verify these systems, to help us monitor them, to make sure that they're operating correctly, that will ultimately help us make better, deeper diagnoses for our patients. So I guess the bottom line is that although the pathologist is at the top of the ladder, at the head of the team, we need all of the other components of this team to be an effective force ultimately for the benefit of our patients. We are currently suffering from a shortage of pathologists worldwide. I actually just gave a presentation earlier today demonstrating a worldwide shortage of pathologists. So it's very important that students that are deciding what type of profession to follow understand how dynamic and how exciting pathology is as a subspecialty. We, of course, work very closely with our colleagues in other parts of medicine. But one thing that we always train our residents to not think of other physicians as the clinicians. Pathologists are also clinicians. True. We care for patients. True. We may not be patient facing as much as other physicians, true, but we are equally engaged with and focused on serving our patients. Pathology represents, the laboratory in pathology typically represents less than 5% of the budget of healthcare. But it's estimated that approximately 70% of decisions made in medicine, in the care of patients, is made based on laboratory and pathology data. So a relatively small investment that results in very valuable information that benefits patients at all levels in healthcare.
True.
A challenge for me is an issue or a situation that is an opportunity to do better. A challenge is something that invokes curiosity. It invokes some resilience. It invokes the need to challenge your mindset about how you currently see things and how you currently see the world. And it's an opportunity to focus on solution. So whereas I think challenges can be very emotionally taxing and we think of them in very negative terms, and sometimes they are, I often think of a challenge as an opportunity to do better. And in healthcare, that pretty much drives why we're here. It is to do better for patients, for ourselves, for our clients, for our organizations. My take-home message is really not to focus on the emotion that it invokes, which is that this is something that's going to cause me problems, but really to think about what is the opportunity that that situation presents you to think better, to learn, to do something differently, to improve a process, to bring more value, to really become curious about what else you could do about that particular situation. If it continues to be there, then it continues to be a challenge. But if you take all of these things into consideration, then the real value of that situation is in the overcoming and the ability to do something new or differently. I don't actually single out the lab for any particular kind of critique. I think the challenges are similar to what we experience in other parts of the organization. When you work in multidisciplinary teams, communication is often one of the areas in which we're most challenged. We're not always in the same room. We don't always hear the same information. Sometimes we need to make changes very quickly, and the pace at which you can get that information communicated to other teams is sometimes lagging for particular people. So I think having strong interprofessional relationships and maintaining them is always a challenge for us with the lab and with any multidisciplinary team. I think sometimes when we hear information from the lab that is not particularly positive, so for example, hemolyzed samples, nurses absolutely hate hearing this thing about hemolyzed samples because it speaks to technique, it speaks to the need to redo certain things.
Prick the patient again.
Absolutely, to prick the patient again. It speaks to all of those things. But again, the communication is the thing that really helps us to overcome those challenges. So if your next question was going to be, is there a particular challenge that you've been able to overcome? That's been one that we have worked really hard on.
Perfect.
In terms of ensuring that we don't personalize the feedback, but we think about what it means for the patient, what it means in terms of cost, what it means in terms of time, what it means in terms of value. We have been able to think about all of those things. And in our emergency department here, for example, we have seen a marked decrease in the number of hemolyzed samples that are going through to the lab just by working really closely with the lab like that. So I think relationships really, really matter for us and the laboratory team.
For me, challenge is whenever you are out of your comfort zone. Challenges will be always there. I can see it as a challenge, but not necessarily you, not necessarily the others. My perspective or the old perspective as a physicians, we consider the lab, or most of the physicians, they consider the lab in general as a tool to help me to diagnose. Now, as administrative point of view, I learned that This is not the case. It's not about a figure you see it, in the piece of paper or on the screen. It's a journey of how this conclusion or evidence, or we can name it whatever, lab results reach you. Now, I know the frustration of or the tense relation between the physicians and the lab community in general. You are pushing always for, asking people to please consider all the impact, or the journey of this lab results, while we are looking for the results to help us, and we cannot understand as a physician why these tools cannot help us sometimes. It's not about the deficient or difficulties within the lab techniques or the results or whatever. It's about how good is your interpretation as a physician with this lab results. Is this a challenge? Yes, it is a challenge. Did I face something like that in the past? Yes, at the administrative as paying physician, I was looking for example, an MRI or some of the specific tests to help me to reach a diagnosis. And then I realized it's not about only reaching the diagnosis. It's about how do you interpret a lot more than lab results. It's not only the lab results. As administrative, I was operating room service director at certain point of my career, and I had an issue with day surgery patient. Some of them they deemed to be, there is no need for transfusion, and some of them you need to transfuse those patients for whatever surgical indication. We were pumped with the fact that you need to have a multiple, cross matching and first screening and then cross matching, and it should be valid with certain validity. So how you can manage that? So it was a pressure from the surgeon. They are looking to have this as a standby. From my perspective as an OR director, I need it to be as a safety tool for my patient. And from the lab perspective, they need to have a definition so they can avoid repeating unnecessary exams to or reducing the cost for something that might be done and might be not done. That was an issue, and we sorted out actually by redefining who are the population in need of this service, how we can screen them, how we can minimize the window or the time frame so they can have a priority to the OR, and avoiding, loss of or waste of resources, manpower, and all the financial impact based on this situation.
Through collaboration, team effort, open communication, having a true objective to solve one problem through a different team members, you were able to solve maybe a chronic issue that was causing maybe a lot of delays for patient care, a lot of delays and overbooking for OR, or for the DPU for no reason, and so on. So I like how you say it, and I like that you openly share physician thought about the lab as a tool. Definitely, I disagree with you or with whoever has this idea. One of the things that we have challenge with, and I would say that openly and publicly also, is that because we as laboratorians do not celebrate our subspecialty and we do not advocate it correctly, we don't really focus on spreading knowledge about our subspecialty. That is showing lack of informing the stakeholders with what we are capable of doing. And I think through such venue and different venues, one day we will reach the objective of knowing, understanding what are our capabilities and moving forward with them.
If you allow me, I will just add 2 points.
Sure.
You mentioned something very important. We in the medical field, we assume that everyone know about us in 100% way. I mean, as a clinician, we assume that the lab community know everything about the physicians. As a lab community, you assume that you know everything about the physicians, and the vice versa, which is not true. Most of the time we lack a lot of information about each other. We lack about a lot of information about how you deal with your own struggles every day, how you are keen to give me the optimum, so optimal service, and to serve my request and ultimately the patient purpose at the end. The other thing is, I learned something very important. When you want to solve whatever problem, you need to find the keyword. The keyword is the shared responsibility. You cannot ask someone to help you in something without defining what do they have in this problem. If they know what they are involved in and why it's going to touch them, definitely they will help you. Other way, you cannot just shout, help me, without, defining the way of how you want other people to help you. Other than that, it will never be solved.